Dr. Melnick, tell us about another innovation which happened in the, in the X-ray technique and in the, overall implant technique, and basically, 3D, where, like with cars or with everything else, we can basically usually at this time really look at things the way they really are rather than a two-dimensional guessing and stuff. And I know you mentioned something in implants, a machine and a technique you're using which helps you to be very, very precise.
Yeah, but we have a machine called a cone beam, and it's a three-dimensional X-ray machine where when we take an X-ray on the outside of the mouth called an extraoral, instead of having a two-dimensional image of somebody's jaw, we now get information that's three dimensions. And we can use that along with impressions or molds of the patient's teeth when we approach implant placement. What we do is we send an X-ray using a special radiographic stent that fits over the patient's teeth along with a model and the X-ray to our lab technician, and by looking at the three-dimensional information from the X-ray, we can precisely decide what the ideal angle and location of the new implant should be in the patient's jawbone. Now, what does this mean for the patient? What this means is, instead of having to cut the gum, push the gum aside, and kind of guess where the implant's going, we can actually drill through the surgical guide stent directly in the jawbone without having to disrupt the soft tissue, the gums. We can place the implant precisely where we predetermined it, and the patients are going to heal quicker and more painlessly. It is not unusual for a patient the day after treatment to not have to take any pain medicine at all following the placement of an implant using a surgical guide stent. It is truly amazing.
Wonderful, wonderful. So basically, you just simply know where you're going with this particular X-ray, the cone thing, and all that. That's basically what it boils down to.
We want to know exactly where the ideal support of bone is. We could pre-plan if we have to add bone. We can make sure if we're putting in a series of implants that they're parallel to each other so that when we go and make whatever's going to attach to the implant, there are no complications. It just simplifies the surgery, and it simplifies and quickens the healing for the patient.
Great. Absolutely great to know. People who hear this will love it. Bye-bye, Dr. Melnick.
Thank you, Helmut.